that about all women, about 50% indeed, have intention to use in future. And of those who have intention to use in future, how many indeed from the ones who are not using a method? We see about 20% or so who are intending to use in future, and what happened to them. So for those who intended to use, we see that about 60% indeed took up a method, but also to note that about 23% of those who had no intention to use still continue to uptake a method. And this is important from programming point of view, that you do not just say, okay, you have expressed no interest and therefore no further information. We should continue to provide information to all those women. This slide will show the changes or the dynamics between the women who wanted a particular method and what eventually they end up getting. To note is that 40% remained non-users, although the intention was there to use. But we see only about 26% between 2020 and 2021, between 2019 and 2020, about 30% adopted the method of their choice, the method they wanted. So there are indeed areas there we need to work on to be able to say, if I wanted an implant, would I get an implant? But of course, there are reasons why you may want an implant and it's not necessarily given to you based on medical eligibility criteria. So it's not only the wish, there are other things to be considered before you're provided a method. So in general, we see that the intention to use is there, but it is notable that even for those who are not using a method, indeed we should not disregard them, we should still focus on them. We see that adolescents, one of the slides did show that adolescents make a very small proportion of people who are taking a method, and therefore we need to continue to advocate for adolescents to Friday services to be able to get the services they require. So let me now turn my attention to fertility preferences and intentions. And over time, we see that nearly over 60% of the women desire to have a child. But more important is that they require to have a child 24 months plus. But we know from our data that indeed quite a number of women are getting children outside their desired widow period. And here we see again dynamics of what has happened over time for the women who expressed certain desires, what has happened between 2019, 2020, 2021. And we can unpack that further to be able to say, yes, exactly what happens to these individuals. But to note that between 2019 and 2021, that nearly 40% of pregnancies have remained unintended, not wanted at that time, or not wanted at all. And that is something, as a nation, we need to think about. And our data, further analysis, will be able to look through what happens. Is it the time women are switching, or what exactly is driving those unintended or unwanted pregnancies? So indeed, we need to think through and look at programs which can help women, those who would have unintended pregnancies, because you know, one unintended pregnancy, there's a chance of repeat unintended pregnancies, so that we can be able then to make sure that they receive the services they require. Advocacy programs are required. This challenge of unintended pregnancies in this country. Let me now talk about partner dynamics, because we know partners, I think was mentioned earlier, are important stakeholders in family planning programs. And indeed, this slide shows us that of the partners who reported to have a supportive partner, 32% adopted a method. Those who say the partner was not supportive, still about 29% adopted a method. And about 17% of those who are not aware whether their partners were supportive or not, adopted a method. But how did the 29% use a method, yet the partners were not supportive? The concept of covert use of family planning. Indeed, that is something which has been reported, and probably that slide probably encourages us to have spousal communication to be able to understand. If you know your partner is not supportive, then the alternatives you can be able to use. Are the men involved from the women's perspective? Absolutely yes. Partners have been involved in terms of knowing the method their partners are using, discussing the decision to delay a pregnancy. We see 81%, 91%. We see that the women say that the decision made was joint, between the person and the partner 54% of the time. So indeed, this is a good finding.